I'm Kristen. I am a nurse practitioner student at the University of Utah, and today I will be demonstrating an IV insertion with aseptic technique. Throughout the procedure, I will be talking aloud, explaining my clinical reasoning through each step. My main priorities for today are for patient safety, infection prevention, patient comfort, and a successful IV insertion. Prior to going into the patient's room for the IV insertion, we'll be performing hand hygiene, either by washing your hands with soap and water or by using a hand sanitizer. You'll be providing your supplies, which would be gloves, the correct IV catheter size, an extension loop, sterile saline for flushing the IV, and an IV start kit, whatever that kit looks like in your hospital setting. Today, my hospital kit consists of a Tegaderm, gauze, an alcohol wipe, and a tourniquet. It is also good to provide some types of underchucks so that you can help maintain an aseptic technique, but also would help prevent any blood from getting onto the patient's bed. Now that we've gathered our supplies, we're going to go meet our patient. Prior to meeting our patient, I will have made sure that I've checked the doctor's orders for an IV insertion order, and also knowing the reason why the IV is being inserted. This will help me decide on which size of IV catheter to use. If the patient will at any point be receiving blood products, I need to make sure I have a 20 gauge or more. If they are just getting fluids or medication and their veins are not very large, or they seem like they would be damaged easily by a larger gauge, a 22 gauge would be acceptable. Let's go meet our patient. Hi, Doc. Hi, Mrs. Brown. How are you today?
Good, how are you?
Doing good. I'm Kristen. I'm going to be your nurse doing your IV today. Did Dr. Brown tell you about wanting an IV placed?
Sure.
Okay. All right, Dr. Brown is wanting to do an IV today so that we can do antibiotics for you.
Okay.
So I'm going to look at your arm, kind of make a decision on where to put in IV, and then we will place your IV today. Okay. Before we get started, can you tell me your name?
Yeah, it's Shallon Brown.
Okay, and then your date of birth.
December 20th, 1981.
Okay, sounds good. Let me just check your information here on your patient band. Okay, everything looks good. So we're gonna go ahead and get started. Okay, are you in a comfortable place?
Mm-hmm.
Okay, let me just get my hand sanitizer on. I brought in all my equipment with me. And then before I actually start your IV, I'm gonna look at your veins and decide which would be a good place to start, okay? I'm gonna place this stripe down underneath you, just to kind of give us a clean, nice space to work. And then you can bring your arm out this way. While you're gathering your supplies and you are getting everything set up, it's ideal to be able to have a table that you can set your stuff on. If you don't have a table that you can set your stuff on, or the patient's table is covered, then you can make an alternate place to put your stuff. You can make a little tray here. You can use part of the patient's bed, just so that you have a place to work and that all of your equipment and all of your supplies are where you can get to them and you don't have to leave the patient's bedside or the patient's room. Okay, before we get started, are you right-handed or left-handed?
Left-handed.
Okay, so we're gonna try doing your IV in your right hand today, just so it's not in your dominant arm and it's easier for you to continue hospital stay. The other thing I wanna do is I would be wanting to look for an IV placement today that is lower. It's best to start with your IVs at a distal location. That way if the IV fails, you still have more IV sites to continue to try using. It also goes on patient comfort though. I was talking to Shallon earlier and you said that you wanted to avoid your hands.
Yeah.
Okay, and so then the other option would be somewhere in the forearm or even a low AC, so that when the IV is taped down and you bend, it's not gonna occlude the IV, okay? So we're gonna look to see where the best place to go is for an IV today. When I'm putting on the tourniquet, I want it to be about 4 to 6 inches above where I think I'm going to be going. So if I want to do a hand, then I'd be going about mid-arm. If I'm going to be doing a low AC, which I'm looking for today, then having it up above, about 4 inches above, is appropriate. The other thing you want to do is you want to find a radial pulse, and you want to make sure that your tourniquet has not occluded your radial pulse. And then as I'm coming in here looking for veins, knowing where your anatomical veins come through, Shallon has a really good vein here. You're going to not just look for it, but you're going to palpate it. And when you palpate a vein, it should be soft and spongy. And bounce up a little. So once you've located the vein and you know where you would like to go, this is where you would use your antiseptic. You can use an alcohol wipe. It is more preferred to use a chlorhexidine If your hospital has that, then you'd be using chlorhexidine and scrubbing the site for 30 seconds. And then while that dries, you can take the tourniquet off and prepare all of your equipment so that when it is dry and ready, then we'll put the tourniquet back on. Okay, now that this is dried and I've set up my equipment, I have a primed extension loop, and then I have my Tegaderm here, which also has a place to write the date. I have my catheter that I've removed from the packaging, and then I have taken it off. I want to make sure that I can see the bevel. When I insert the IV, I want it to be bevel up. There is a place here to hold like a finger hole, and then this is a retractor where the needle will retract into. So Shallon, we have found her vein. And then what I'm going to be doing is doing the insertion, and then I will talk you through as we go. Okay, maybe a little poke here. Maybe 1, 2, 3. Insertion at about 10 degrees. We'll be waiting for a flash. Then as we get the flash, we're going to put down, go a little bit further forward, and then slide the catheter in. Notice that I slid that in without sliding the needle forward. You do not want to slide the needle forward once you get your flash. You then push your safety button, retract the needle in, and then this is a blood control catheter, which is really nice. If there was not a blood control catheter, you'd want to be holding pressure up above the catheter to keep the blood from coming out. Then I'm going to release the tourniquet. I do not need that anymore. And at this point, I'm going to check to see the patency of the IV prior to taping it down. So I'll secure this here. This is already flushed and primed. And then I want to be able to flush without there being any type of resistance. If there is any resistance or pain, is there any pain at the site? Everything feels good. Then I can go ahead and say that this is a good IV. And then I will then tape it down and secure it. So I'm going to take the Tegaderm, place it over, secure that in place. And then you want to make sure that none of that blood has backed up into there. So flush it just a little bit more and then secure it with the lock. And then I will tape it. You don't want to tape across the Tegaderm. You want to tape it just slightly to the side so that you can continue to visualize where the IV is inserted. So you know if there's any signs of infections or pain or swelling. And then here I'll be writing my initials, date and time. And then a lot of times you can just use that to secure. Okay. And that completes our process. Okay, now that we've completed our IV, I would make sure that I put my sharps into a sharps container, and then I will go chart my IV. I need to make sure I put down the site, the gauge, the condition of the site, and the time and date that it was done.